Well, for our last guest, I want to introduce you to Monical Beilski Boris. Now that's a mouthful. I met her. She represents city employees here. She's an AFSCME Council 75 employee herself. She's a graduate PhD from Rutgers Labor Management Relations. So she's been in this labor movement for over 17 years. I want you to listen to this person. She represents union people right here in this city, all across around Lane County, okay? Monica, where are you? Thank you.
Thank you. I'm so pleased to be here, and I wanted to offer a message of support from the labor movement. The overwhelming majority of union members do have health insurance, and one of the things that's very frustrating is that oftentimes it comes up as a sort of a critique of universal health care to say, what about the people who, speaking of unionized workers with health insurance, the firefighters, what about the people who have fought for health care through their employer, through their unions, and to use that as a critique? And one of the things that I'm very proud to say is that AFSCME, even though our members have health insurance, have supported universal health care for quite some time. Because I think there is a fallacy that people who have employer-provided health care are happy with their health insurance. Increasingly, we see rising premiums, high deductibles, limited care, higher copays, all of the things that erode health care. It's also a worker power issue. Every time we come to the bargaining table, healthcare is in play, and the threat of reducing healthcare benefits is something that's used as a tool by many employers to keep wages down, right? They've done studies that have shown one of the reasons why teachers in this country are paid so little is because, they're forced to make a decision between money in their paychecks and their healthcare benefits, and it shouldn't be that way. Healthcare should be something that is a universal right. It's also something that holds people hostage to employers. You meet people continually who would love to be able to retire. Their bodies can no longer, do the physical work that they do, and they push themselves. I can speak from experience from my mother-in-law, who was a unionized janitor, who had to work until 65 regardless, because she needed her health care. And as a cancer survivor, even if she had unlimited funds, it would be very difficult for her to have purchased private insurance. So that's why the labor movement has stood firmly behind universal health care for all and believes that it's a universal right, and really has wanted to partner in all efforts to try to make health care available to all workers. It shouldn't be determined that you have a job, that you work for a certain employer, whether or not basically you live or die, right? And so thank you so much, and keep up the fight, and AFSCME will be right alongside with you.